A very good morning to you, and thank you for joining us for yet another beautiful edition of the Glaucoma Awareness Program. This is the first edition for the year, and as we've stepped into a brand new year filled with hopes, plans, and resolutions, one gift we often take for granted is our sight. Clear vision is not just about seeing well. It's about living fully, about safe navigation, is about independence. And every single day I wonder what life will be without vision. I have friends, I have colleagues whose careers have been affected grossly and negatively because they can't see anymore. So today on Glaucoma on radio, on Solid 100.9 FM in collaboration with the Eye Specialist Hospital Enugu, we're turning the spotlight on glaucoma, a silent but serious eye condition that remains one of the leading causes of irreversible blindness, especially in our environment. And you don't need to lose your sight to begin to know how to take care of your sight. Of course, with us is a highly respected consultant ophthalmologist and the glaucoma expert, Professor Nkizu Akariwe, who will help us understand how to protect our eyes, detect glaucoma early, and make clear vision a conscious goal for this new year. Professor Nkiru is also the governor representing Africa World Glaucoma Association Board of Governors. Good morning, Prof.
Good morning, Lucy.
Okay.
Good morning, our listeners.
All right. I'd like to say that this is not just a medical conversation. It is a life-saving one. So stay tuned and also feel free to ask questions. So, Prof, as we begin the year with the team New Year Clear Vision, why do you think this is a very timely conversation for Nigerians?
Yeah, thank you very much. You see, it's usually, like you said, this is a new year. In the new year, we make new resolutions. We do our goals for the year. We rejig our vision, what we want to achieve for a better life, better health, and all. So I think is a timely topic for today. Today being the 2nd of January, and we're just starting the year. And we've been on this glaucoma on radio, and some of our listeners, you've been with us right from the beginning, and it's been a very informative series, I must say, that if anybody's been following us, they would have become quite well informed about glaucoma. And so at this time we are discussing on this new vision, a clear vision, that because when you see well, if you see well, then you will get to where, more likely get to where you're going. But if your vision is blurred, if your vision is not good, then you will miss your steps, and you may fall. And we're talking about glaucoma, which happens to be an eye condition that the damage it causes is irreversible. So it's, when we talk about maybe a stitch in time saves 9, it applies actually, because in terms of if glaucoma is discovered early, you might need just a stitch to deal with it, unlike when it's discovered late. But when it's even discovered much later at the end stage of it, at that stage there's even nothing to do. So when we talk about maybe prevention is better than cure, there's no cure for it. So, and that's why this morning, today's first episode of the year, we're saying we want to talk about what to do so that you can maintain clear vision.
All right. We don't assume everybody understands what glaucoma is, and there are those who are joining us for the very first time.
That's true.
So for someone who's hearing the word for the first time, what exactly is glaucoma? and why is it often referred to as the silent thief of sight?
Yeah, glaucoma, as you mentioned, is the leading cause of irreversible blindness. It's actually a slowly progressive damage to the eye nerve, the nerve for vision, which is called optic nerve. Okay, it's the condition slowly damages it. It's actually a group of diseases, but they have a characteristic way they damage that nerve, and because of that characteristic way, its effect has a characteristic way of showing up. Okay, and it's more common among the blacks, more common among Africans. It's also more common as one gets older.
Okay.
So someone who is 80 years old is more likely to have it than a 40-year-old.
Okay.
In fact, actually, an 80-year-old is 5 times at greater risk of having it than a 40-year-old. Okay, but then it affects all ages. Okay, so but it's just that it gets more prevalent as one adds on. Yeah, and if there's a positive family history, in other words, if somebody in the family has had it, then all the persons connected to the person by blood are more likely to have it, especially the first degree relatives. What I mean, the father, the mother, the siblings, and especially the siblings, the children also. Now, with also when you come down to Nigeria, it's also much more prevalent among the Igbo tribe. So that Igbo tribe is also a risk factor for developing it. So what we're saying, and then of course there are a few other things that make somebody more predisposed to having it. For instance, if one very major one I haven't mentioned, which is actually a main risk factor, is the raised intraocular pressure. The way the body has blood pressure, and we measure it, the eye also has pressure. We call it eye pressure or intraocular pressure. So if the intraocular pressure is raised, it has a normal range, it is the person is more likely to develop glaucoma. And then of course, if somebody is hypertensive, if somebody is diabetic, if somebody is short-sighted or long-sighted, the risk also increases. So we are and then there's something we call the cornea. The cornea is what looks like glass in front of our eyes. If that cornea, your own is thin, it also predisposes someone to having glaucoma. So that's glaucoma. But usually glaucoma, when it begins to cause damage, there is no pain, there's no redness, there's no itching, nothing. So generally, the person who has glaucoma does not know that they have glaucoma, and meanwhile it's there and
causing damage.
Yes, causing damage to the nerve. Now, what does that eye nerve do? The eye nerve connects the light rays that enter the eyes with the brain. It is the brain that interprets the rays that are coming from you see, and I say, oh, that's you see. Okay, and if you smile, the brain interprets, oh, he's smiling. So that connection gets destroyed because it's the nerve that does that connection. And so the light rays are entering the eye, but there's no transmission of the impulses to the brain for interpretation, and so the eye is not seeing anything. So the reason we say is a silent thief of sight is that it's there in the eye and it's causing no symptoms. The person who has it does not know until the person is almost blind. And meanwhile, from the study we did, it takes in our own environment maybe an average of 6 years. Some people is much earlier, some people it takes longer for it to have been in the eye to cause blindness. And meanwhile, the person wouldn't know. Okay, so what's we say it steals your sight silently, and so it has that nickname. The way some people will say, my guy name is glaucoma zone is the silent thief of sight. And it sounds sweet talking about it, just but it's a terrible thing. It's a terrible thing when it's not discovered early, because the damage you can't reverse. I have so many patients, and typically a lot of our patients come late, unfortunately. And that's why the Solid FM is partnering as part of its goodwill for the people, to enlighten our people. So this I was saying, I have so many patients who come, and maybe you do surgery for them, you bring down their eye pressures, and maybe like the aim of treatment is to stop the damage from going on. The damage already caused, you can't reverse. So now the patient is telling you, oh doctor, thank you very much, my pressure, I'm so happy, is still down, it's nicely down, but this smoke is still there.
You're saying smoke?
So when glaucoma, towards the end stage of the disease, it begins to give smoky vision. So somebody wakes up and feels that there is harmattan, and there's smoke. Maybe are some people burning something nearby that has filled the room, and everybody says no, there's no smoke. And say, I bet there is smoke, and say, go to hospital. And at that stage, maybe there's only 2% of nerves remaining, maybe at best 5%.
That's quarter to go.
Yes, 5% is remaining. And then you now do all you can do. Most times at that stage they are needing surgery. You do all you can do to bring the eye pressures down so damage doesn't continue. And they say, thank you very much, but what of the smoke? And that smoke, you can't remove it. Only God can do it. So we said, well, that's the best we can do to stop it where it has reached. Any other reversal is by divine intervention. The much medical science can do is maintain what you have. So that's part of why we're here. Don't wait till for glaucoma to hit you at that stage. Don't wait. We want you to maintain clear vision. Smoky vision is better than no vision at all. I can tell you, I'm telling you, it's really far better than no vision. But
that also means that when you get there, it's almost gone.
It means it's almost gone. So you are really between the devil and the beast.
I think we should do a bit of clarification between other eye conditions.
Yes.
For instance, if I have cataract,
yes,
and I get surgery, I regain my sight.
That's right.
But in the case of glaucoma, whatever is remaining is what is left.
That is what.
Whatever has gone cannot. You might want to buttress on that.
You will soon be an associate glaucoma doctor. Yeah, so where like Lucy was mentioning that the glaucoma, there are different types of eye condition, and that's also part of the unfortunate thing, because somebody will, when they begin to have symptoms in glaucoma start very late in the disease. They tell their neighbor, I'm having some, say, don't worry, it must be cataract. And it is not cataract. Now, cataract is the leading cause of blindness. But fortunately, cataract, when you operate on it, you can regain your vision, unless it has reached the complicated stage. So, and that's the more common condition. So, and that is different. So please don't confuse cataract with glaucoma. There's also the one that is called trachoma.
Trachoma.
Yes, trachoma is a condition that used to blind the people from the north much more. If you observe, we don't have them. For those who are older, unlike before, you used to see a lot of blind northerners, begging. But these days you don't see that much, because the condition that used to blind them that much was trachoma.
Okay.
And that one was associated with flies infection and some complications. Okay. And but so because it's an environmental thing, that has been handled. Okay. With providing them water and teaching them cleanliness and all that, and so that has gone down. And so glaucoma is now the challenge, and unfortunately the southeast has the brunt of it. And there's nothing that can be done about it. And so it's wisdom. We also have another that we call macular degeneration, age-related macular degeneration, but it affects the older people, 60 and above, much more. Okay, and that one, there's also not much you can do about it when it begins to present with symptoms. So in other words, what we're saying is that there are different eye conditions, but the most important, the one we are talking about today, and we talk about every Friday morning, is glaucoma, because it's very rampant in our part of the world, and you cannot do anything about the damage that it causes. And so we're here to say, do something before glaucoma gets you.
Okay, another clarification I'd like you to do. You were talking about pressure, the pressure in the eye. I've had someone say, that's why I need that clarification, that you could actually have moderate pressure and still have glaucoma.
Yes, we can have normal pressure actually and still have glaucoma.
Okay.
But we are saying that if your pressure is high, it's a risk factor. But that doesn't mean that your pressure must be high for you to have glaucoma. There are some glaucomas we call the normal pressure glaucoma. And actually in the southeast here, the type of glaucomas are generally low pressures. Yes, they are not the very high type of pressures. Okay, so our average pressure in the southeast is much lower than other parts of the country.
Is there any reason for that?
I think it's all genetically determined. So what we're saying is that if you find your eye with high pressure, you're more likely to have glaucoma. But even when it is normal, it doesn't mean you cannot have glaucoma. So evaluating for whether you have glaucoma or not is not just to check eye pressure. We wish it was like that. That would have
been not that simple.
Yes, that would have made, sincerely, that would have made life so much easier. But unfortunately, you can have normal pressure and have glaucoma. So that eye nerve must be examined to know whether damage has started there or not.
And that puts a lot of responsibility on individuals to do regular checks.
Exactly.
Because there's no way you can know.
No way you can know. And if you want to wait to know,
it might be 2% remaining.
Yeah, it might be 2% remaining.
Okay. So how often should an average adult have an eye check, even when there's no obvious problem in your eyes?
We advise, so you don't forget, do it once every year. As like a birthday present for yourself, so you can determine in the month of your birth, you have an eye check.
Ours is November, so we can't wait till November.
Now on the other hand, every March, second week of March, usually there's a World Glaucoma Week. And every March, and usually there's a lot of awareness made around that time. And
so you could also plan around that
time. And if you say that I can't afford it, usually around that time, different hospitals do free glaucoma screening, so you can gain on that. You don't have to spend to have your eyes checked. Now remember, we said a stitching time saves 9. Now when glaucoma is detected early, it's so much more cheaper to treat it. and handle it than if it's detected late. It's so much more cheaper. So we encourage. There are three major ways of treating glaucoma: medically, with laser, or with surgery. Now, the simplest of them all is the laser. And if you are picked early and laser, for instance, is done, the laser could last up to 5 years.
Okay.
But it could last an average of 3 years. Now, and you can repeat it. Once you've responded to the treatment, then you're more likely to respond again. Now, the laser treatment is so simple and safe that you don't know something has been done. And then you go about your life. Okay? So the only thing that will be required of you is from time to time, and that's a max of maybe once in 3 months, either once in 3 months, you go and have your pressures checked. Okay, so, and that's all. So no putting anything, no side effects, nothing. So you can actually live your life the way you've been living it, apart from those checks to go and check whether the pressure is still good, okay, or still where you want it to be. So that's the internationally now, that's the first go-to place in form of treatment for glaucoma, but usually better used when it is early glaucoma or at most moderate glaucoma. By the time it's advanced, it is not enough. The laser is usually not enough to handle it, but except you're going to combine it with other forms of treatment. Okay, so I've talked about laser. Then medical, you can use drops as treatments. Okay, and there are different classes of drops. The only thing is that sometimes the drops have side effects. Okay, they can make your eyes red. They can make your eyes feel like there's sand in it, feel like some foreign body entered into it, because tearing and all that. So, and then also you have to remember to use your medications every day. If those drops are to be put 3 times a day, you are not permitted to forget. If it is the one that is once a day, great. But many times when our people present late, one drug is usually not enough. So you have to put a number of drops to be able to achieve what you want to achieve. Okay, and then the last option is surgery. It's important for our listeners to know that there are some medication, some glaucomas that don't respond to anything else except surgery. So you use all the medications in the world, it doesn't respond. Do the lasers, it doesn't respond. And the only thing that it will respond to is surgery. And so many people have said that they heard surgery is not done for glaucoma. Please, if you're listening to us this morning, surgery is done in glaucoma eyes. If you hear, please tell your neighbor, glaucoma you can be operated on successfully. Okay, so because when you see people who are young, there's no point, walking around with them. If you see it in a child, you have to do surgery. You see it in a young person, you have to do surgery, except that young person is responsible enough to manage the laser. And when I mean managing the laser, is that person will not forget they have a problem and not come back again for follow-up. Okay, otherwise you do surgery. Okay, and then of course once it's an advanced condition, the best thing is to do surgery. Okay, so those are the 3 major ways that glaucoma is treated. And the aim of treatment is to bring the eye pressure down. So even in those normal glaucoma cases, we bring the eye pressure down to a level further damage will not continue. Okay, so and that's the aim, to stop further damage. But to recover what has been damaged, that is not part of the.
While you were talking, I was wondering why we take our eyes for granted.
I don't know.
Is it? Will you call it low awareness? I mean, we just don't do anything until it's late.
Yeah, it's it's part of, it's actually all over the world. But of course it's worse in the developing countries. So even in the developed countries where there is available free screening, the Caucasians are more likely to take up than the African Americans, for instance.
Because there are people who are more mindful of maybe their BP states.
Yes.
Like in Africa, somebody is more conscious of, I have BP, and so they take their drugs as and when do.
Yes, but it's surprising to know that somebody say, well, that I'm okay. When I feel headache, I take it. I say, how are you managing BP like that? You want it to give you a stroke. So it's there's low level of awareness and consciousness, and we feel that, look, that one is not my problem. I'm talking about finding food to eat. Unfortunately, it's really not about finding food to eat, because even among those who have food to eat, going for checks, how much more eye checks? The uptake is low. And so we're saying this new year, take a decision, make a decision that this foolishness, permits me to use the word, let it come to an end. That let me do myself some good. Sincerely, you can't afford to lose your sight.
Yeah.
Close those eyes for some 5 minutes and see and try to move
see how
around.
Difficult it is.
It's a different world. You can't do that to yourself. So we are asking you this year, just make a decision that, in fact, this carelessness over my eyes, they are very precious. Let me stop it. At least, what does it cost? Once a year, let me check and be sure that everything is okay. If I have a car, I go for
people take care of their cars more than they take care of themselves.
Their bodies, that's true.
Sadly so.
Yeah.
Okay, now let's try to tackle some of these myths. There are those who believe that glaucoma is caused by witchcraft, phone screens, or spiritual attacks. So let's deal with the gamut of myths that do not hold water, that affect the way people see this thing we're talking about.
Interestingly, yesterday I was with a young man who told me that he's been having headaches, terrible headaches, and he's gone, he saw the physician.
Does he have glaucoma?
Hold on. Headaches. He even did an MRI, and nothing was seen. That he was about to say, no, this is village, maybe my village people have come for me. When his wife said, interestingly, his wife had worked with us, said, why don't you check your eyes? And he comes to check his eyes, and he finds out that, he has what we call astigmatism, and that's what's giving him headaches. He says he had these headaches for months. So he's given a pair of glasses, and he said in 3 days the headaches stopped completely. It was like a miracle. he never knew I could give him headaches like that, eye problem. That he had concluded this is a spiritual attack. So I'm just trying to address the matter of myths in terms of witchcraft, spiritual attack. Please check your eyes. Pick it early, even if it's a spiritual attack. Pick it early. Believe me, you will say overnight. I've talked with a senator once, and he was heartbroken because his very trusted PA, young man, he said he just woke up one morning and he couldn't see. And it's like, is this a joke?
That's the type they say is from the village.
Exactly. He says, is it a joke? He takes him to the hospital, and then
play.
And they say it's glaucoma. He even took him to India, and they say nothing can be done. It's glaucoma. So he said, but he was okay. He was seeing. I said, it just happened overnight. I said, it really didn't happen overnight.
It's just that he didn't know it was happening.
He didn't know it was happening. So my people out there, don't, even if spiritual attack can allow us to find it early, present your eyes for checks, so that if the attack comes, it is picked early.
Yeah.
Okay. We will now agree with you. It's an attack. If everything, whether medical, laser, surgery, everything is done and it refuses to respond to anything, then we know this one is really an attack, and we will agree with you on that. So please, the glaucoma has its process. It has a natural history. It starts and the way it progresses. Most of our patients, the study done in Nigeria, but that is over 15 years ago, showed that 95% of those who have glaucoma did not know they had glaucoma. So only about 5% of those who had it knew they had it. So we're talking about, if you take 100 people who had glaucoma, only 5 knew they had it. 95 had glaucoma, but they didn't know.
95%. That's huge.
It's huge. They didn't know. And the values in Africa, it's all 92 and above. Of those, but in developed countries, about 50%.
Wow.
So we're saying that don't be among that statistics. Don't be among the number. Check.
And one other thing we need to deal with before we go for a commercial break is, people don't like imagining it, but I think it's safe. I imagine I go blind right now. Money that I will have used for the check or to get an eyeglass will not be an issue anymore
at all.
No, the moment you lose your sight, it ceases to be an issue. For now, you say person they talk of waiting to chop, they talk of eye, and you don't even understand that it is the eyes that is helping you to move around. So that was why at the beginning we said it's not just about seeing, it's about your mobility.
That's right.
I mean, the moment you lose your sight right now, you become a burden. I mean, people have to drag you around for you to see. So maybe part of the decision we have to make is to prioritize it. To understand that this thing that you are calling money will not be money the moment you cannot move around.
I'm telling you, it's a different world. Is a different world. Sometimes it's very heartbreaking when you see patients receive the diagnosis and you are doing explanation. They are waiting for you. When you finish all this English you're speaking, okay, so what will be done now? You now say
nothing can be done.
No. Some just break down and start weeping. I'm talking of mature men, mature women. They just start weeping. It's like, no, doctor, do something. There must be something that can be done. And the more painful, often, are even those who have been diagnosed with it.
They took it for granted.
They say, I beg, and they they just went their way and forgot. The one I hear from young men is "Nwoke n'ife," and a young man has to be, hustling now. I say hustling, just like you said, these eyes, and so you hustle until the remaining good eye is about to go. Hi.
That's when they show
it is bad.
It's terrible.
Yeah, it's bad.
I have friends who are visually impaired, and I can tell you, if there's any disability that one should not have, it shouldn't be visual.
Lose a limb, please.
Yes, but not your eyes.
Lose a limb, but not your eyes.
All right, welcome back. The call lines are open: 0704 550 2840. You can also call 0909 771 1009, 0909 771 1009, or 0704 550 2840. We're talking about glaucoma, and as we've stepped into the new year, you can do yourself the favor of checking your eyes. Okay, but let's continue the conversation as we wait for the call. If someone is diagnosed early, can they still live a normal, productive life?
Yes, that's very. That's what the person can live a normal, productive life, and that's why we are creating all this awareness, so that your life will not be hampered for glaucoma if it comes to be picked early. So it doesn't hinder you from doing anything apart from going for your checkups and running your investigations. You can still live your normal life, carry out your normal profession, anything.
All right, the talk lines are still open. If you're finding it difficult getting through with those lines, you can also reach us on 0813 314 2282, 0813 314 2282. But the studio lines are 0704 550 2840. You can ask questions. If you're already living with glaucoma, you can also share your experiences with us. 0909 771 1009. Let me also ask, how important is treatment compliance, and what happens when patients stop using their eye drops?
All right, thank you for that very important question. In fact, it's part of the thing that those who have glaucoma already and are on medical treatment, part of the decision they should take this year. We talk about New Year resolutions, so it's part of the resolution issue that this year I opt for better compliance. I opt for vision maintenance. I opt for fight against glaucoma blindness. Okay, so medications. If you're on medications, for instance, the medications have their duration of action. So if, for instance, you're asked to use your medications 2 times a day, maybe say 7 a.m. and 7 p.m., it means that medication has a 12-hour activity. So by the time the 12th hour is ending, you are using it again.
So you don't take it when you want to.
So I'll just use it haphazardly. So we're saying this year, resolve to comply to your treatment regimen. Okay, now if you have 2 drops, for instance, coinciding at the same time, you give some 5 minutes interval. But some medications are once a day, some are twice a day, some are 3 times, and some are 4 times. Now, if you have many medications, because a number of our patients get to have many because they come in late, it's important to ask your doctor which are the ones that are for glaucoma. Why am I telling you to do this? Now, I said that glaucoma medications could give you side effects. Now, sometimes both to prevent the side effects or to handle the side effects, some other medications are given to the patient. So, a patient might have like up to 5 eye drops they are using. Some might have 4 they are using. And so you say, are you still on your drugs? Say yes, only one has finished. And in that person's own estimation, if 4 is still remaining, only one has finished, is not bad. But that one that finished might be the most important. So of the 5 drops the person is using, only 2 might be for glaucoma.
Okay.
And the other 3 are the support drugs because of side effects. So it's important to know which are those glaucoma medications that must not be stopped.
Okay.
So that you ensure that you have them. So before your glaucoma medications finish, you have replaced them already. And what we advise, have one in spare. Have one as spare. Once you enter it, you begin to buy the next set. Okay. So, and if you can have a regular place where you make your drug purchases, that is better, so that perchance your medications are changed. If you haven't opened them, you can return them to the same pharmacy and get the new one that's been prescribed for you.
Okay, I can only hope that people have health goals for the year.
That will be
they should,
yeah.
But so let's do a final call to action. Our time is up.
Okay. As we didn't have much calls today, people are celebrating. It's we hope that some persons got to hear, and our call to action for us this year is, remember that there is a silent thief of sight, and we are saying this year, prioritize your eye. This year, don't allow glaucoma to blind you. This year, decide you will, going forward, have an eye check, have a glaucoma screening, have an eye screening every year to prevent avoidable blindness. And if already you've been diagnosed with glaucoma, this year we are asking you, don't stop your treatment. Don't stop going for your checkups, because the drugs that are working today can stop working tomorrow. The eyes just stop responding to them. If you don't go for checkup, you won't know. Then for those who also have it already, if you've been advised to do surgery, don't run away. Seek a second opinion if you're not sure, from a good source, and have surgery if you need it, so that you can avoid blindness.
All right. Thank you, Professor Nkiru. It's been awesome. This is a new year. Don't wait until your vision is lost before you can start valuing it. Early detection, safe sight. New year, clear vision, healthy eyes. Do have a beautiful day ahead of you.